You know, I say this, and, some people may not believe me, but I know that having that neurostimulator put in saved my life because it gave me hope, and it gave me so much because I was able to be that person, at least on my way to being that person that I once was, and one that I hadn't been for so many years, because of the pain. That pain takes so much away from you. So having a neurostimulator implanted, it's not for everybody, and I want to definitely tell you, it's not a cure. It is like it's it's like just another way of treating your migraine. Just like your preventatives help prevent them coming on, like your abortives once you feel them coming on. This is something that you can actually control with a remote control that you receive, and you can lower, or raise the frequency of the stimulation that you feel. I actually have a 4-lead system. There are 2 leads out there. There's 4 leads. I chose to have the 4-lead. It's supraorbital, which goes in the front, and then occipital leads that go in the back. So you sort of get it all over. The reason I chose this was to, and not choose the 2-lead, was because a lot of my migraines are in the front behind my eye. And I also heard that some people that have received the 2 leads, your migraine moves, and knowing my luck, that would have happened to me. So I wanted to make sure all my bases were covered. So I had that done. It was a big success. I would do it all over again in a heartbeat. But I did want to let everybody know, since they've been asking how I've been, a couple months back, I did have a little issue. I dropped back down into my bed. I was bedridden for a couple months. Couldn't quite understand why my neurostimulator, it didn't actually stop working. I could feel it. I could still feel all the stimulation in each lead. I could turn it up and down, so I knew that it was functioning properly. Usually when you're not getting the the relief that you need through your neurostimulation, the first thing you think of is that you need to get reprogrammed. Maybe something changed within your, in your head or with the neurostimulator. So, I had some different programming on there. I had, reprogrammed and wanted to see, and for something, I knew deep in my heart that it was not my neurostimulator. So I went the normal route that any migraine patient would take, and I called my neurologist. It's very important, even when you have these things done, whether it be a neurostimulator, whether it be nerve decompression, you still need to keep a regular neurologist on your side to help you with medication dosage, to help you when something like this happens. So I called my doctor, and the first thing he thought of was to prescribe me steroids. That seems to help with breaking a really bad cycle, and it does help a lot of people. Unfortunately, it did not help me this time. The next thing was to try some other medication. As far as abortives, tried that. Nothing worked. So then he and my family decided that the next thing to do would be to go into inpatient therapy, where they do everything by a PICC line, that goes directly in. So I was at Jefferson Hospital for, I think, 5 or 6 days this time. I had done it before, twice before, but this was all new since I had a neurostimulator in now. The 5th day, all the drugs that were being pumped into me, I think it was lidocaine, DHE, Reglan, Benadryl, and something else, maybe Toradol. Not sure. Don't quote me on that last one, but I know there were like 4 or 5 different ones going in. they didn't help me until the 5th day. It came down. It was there for a good amount of time, maybe 12 hours or so. So my husband came to pick me up the next day. On the way home, and this has happened before, on the way home, migraines shot up again. I blame it on all the bumps on the turnpike in Pennsylvania. But, you know, it could just be the ride. It could be the reflection coming in. I have a load of triggers, as many migraine sufferers do. So, once again, back in bed. So I started wondering, okay, what else can I do? Let's, you know, go back. I mean, my mouth was drooping. My speech was being impaired. So I thought, okay, let's try to think. So I decided to go to a chiropractor whom I trusted, knew of, you know, trusted with my life, and also to trust him with my neurostimulator, because I have wires. I have wires and leads and a battery pack in. So I knew him and he knew of my circumstance. So I went into him. We had some x-rays done, and come to find out that I have a lot of structural abnormalities in my neck. Normally your neck is supposed to be sort of, you know, bent, sort of like the shape of a banana. So I'm told mine is straight up and down, which causes a lot of issues. Now, I've been like that probably all my life, but through the years having it like that, I mean, that could have been what started my migraines in the first place. Who knows? I mean, I am from a family of migraineurs, so obviously it is hereditary. But because of the structural abnormalities that I have in my neck, it caused the muscle and the tendons and the nerves, everything, all the tissue around my neck and the bones in my neck to form pods of, I don't even know how to explain it. It just formed pods of build up nerve, and the nerves were wrapped around like all the, I wish I knew the technical term for this, and I do, it's just out there, migraine brain obviously. But between the chiropractor and then I started seeing a migraine or a medical masseuse that was very familiar with migraine patients who had been recommended to me. We started knocking the knots. That's not the technical term, but that's what I'm going to say. That's what, in layman's terms, what I would call them are, they formed huge knots around C1, C2, and further down, which after loads of talking and doing, we as a team figured out that that was probably what was interfering with the signals from my stimulator, interfering with that pain. So after many weeks of going to my massage guy, he is absolutely wonderful, although he makes me cry every single time because it's not a frou-frou massage. It's not relaxing at all. It is definitely very, very painful. He likes to get in there and really try to work, and he's been working with my jaw. Actually, we haven't moved from my neck. I mean, he does a little bit on my shoulders just because of the stress part of it, but it's mainly been in these areas right back behind here and also in my jaw area. The chiropractor's been working on C1 and C2 to try to adjust those back into where they're supposed to be and have them stay there, and not have bone on bone, and you know, not have any nerves pinched. So good news, after all of that, this is getting very long. Don't even know if I can get this posted with as long as it is, but good news is I am back. I have been doing really, really well the past couple weeks. I still go to my chiropractor, but we are bumped down. It was 3 times a week, now it's 2, And this is the first week I was going to the massage to have massage done once a week. This is the first week I'm skipping it and going to try every other. But we definitely want to make sure that these vertebrae are holding where they're supposed to, and that more knots are not forming, and you know. So anyway, my stimulator has been working all along. It was something individually for me that was keeping it from working, I believe. So I am feeling the stimulation. It's actually interfering with the pain signals. And the way I know this is I turned my stimulator off just a few days ago and immediately felt migraine pain. I have had some migraines where I've had to do an injection. That's totally normal. Like I said, you still need to keep with your neurologist because you still do need your possibly preventatives. I'm trying to wean off of those, not right this minute, but I did in the past a little bit. I still have breakthrough migraines. I mean, this neurostimulator, it is to help you control your pain, and that's exactly what it does. And I couldn't be more happy with the decisions that I've made. For me, they were the right ones, and it could be right for you. It could not be right for you. It's something you have to do for you, for your family, for your life, and for your friends. I'm back to being a wife. I'm trying to get my house back in order because it's been a while. I'm back to being a mom, getting ready to take my daughter school clothes shopping. Something I've missed out on for quite some time. Was not able to do it last year. And I actually have a wedding that I'm planning for my oldest daughter. And that's been a lot of fun. What else? I think that's about it, and I think I might have to cut this one, chop it up a little bit, but just wanted to let you know where I was and what was happening with me, to let you know if you have a neurostimulator, or if you don't, not to give up hope. We are, as a team, me, so many other advocates that are out there, we're going to fight this fight. There are 30-some million people that suffer from this disease that takes away their life, and I refuse, refuse to just give up on everything. I need to do this for me. My daughter suffers from migraines. I need to do it for her, and I really want to do it for all the friends that I have made through Facebook and through meeting them, you know, just meeting them by phone calls and talking to them and emailing. It has become my goal. I am determined and needing to get out there and raise awareness about this. We need to raise more awareness, and we definitely need more funding for this. It's taking too many people away, and the pain that people have, sometimes they cannot deal with the pain, and I've been there. I know what that's like, and I don't want to lose any more friends because of this disease. Sorry, I got a little, but anyway, I hope you all have a great day. Again, I'll be seeing you really soon via YouTube or Ustream or on webinar chat. All that stuff is coming to real life pretty soon for me. So take care. I love you guys. Thanks for tuning in. And I'm going to steal a quote, and hopefully he doesn't mind. I should have asked him before, but I have a good friend who also has a neurostimulator that I chat with pretty often, and he has been closing his comments and whatnot with the word "live in peace, not pieces." I'm going to use that for all of you. Hang in there, have hope, and for those that can't fight, know that there are other people out there that are going to fight for you, okay? I promise. Talk to you all later. Take care. Bye-bye.